Bicep brachii, the origin for the long head is supraglenoid tubercle of scapula. The short head is the coracoid process of scapula. The insertion is radial tuberosity. Its action is elbow flexion and forearm supination, and the nerve is musculocutaneous.
To test the biceps brachii, short head, the elbow should be flexed slightly less than or at a right angle with the forearm and supination. Put pressure against the lower forearm in the direction of extension.
Hold, don't let me move you.
For long head, put the arm fully extended and put pressure against the lower forearm in the direction of extension.
Hold, don't let me move you.
Go.
The triceps muscle. The origin, it's got 3 of them. The long head is the infraglenoid tubercle of the scapula. The lateral head is inferior to the greater tubercle on the posterior humerus. The medial head is posterior surface of the humerus. The insertion of it is the olecranon process of the ulna. Its action is elbow extension. It's innervated by the radial nerve.
With the patient sitting, put the shoulder into flexion, the elbow into slight flexion, and then support behind the shoulder and apply pressure to the forearm.
Hold, don't let me move you.
Brachioradialis. Its origin is the lateral supracondyle ridge of the humerus. It inserts into the styloid process of the radius. Its action is elbow flexion, and it is innervated by the radial nerve. Radialis, you're going to have your patient's arm at their side and their elbow flexed slightly with their arm in neutral position, and you apply pressure to the distal forearm. Hold, don't let me move you. Supinator, its origin is on the lateral epicondyle of the humerus and adjacent ulna. It inserts into the anterior surface of the proximal radius. Its action is forearm supination. It is innervated by the radial nerve. The supinator, you're going to have your patient be in shoulder flexion. You're going to grab at the wrist, and you're going to apply pressure into pronation. Say, hold, don't let me move you.
The origin is the medial epicondyle of the humerus and coronoid process of the ulna. The insertion is the lateral aspect of radius at its midpoint. The action is forearm pronation and assistive and elbow flexion. The nerve is the median nerve.
Today we're going to be testing pronator teres, and I would have her arm come forward straight like this, support that arm. I'm going to use my hand here to move her hand from the neutral position into supination as she opposes that into pronation. And I count, hold, don't let me move you. Good job.
Extensor carpi radialis brevis. The origin is the lateral epicondyle of humerus. The insertion is the base of the third metacarpal. The action is wrist extension. The nerve is radial nerve.
Okay, we're going to be setting up extensor carpi radialis brevis. You're going to have them supported. You could use something such as a pillow and have their arm flat like this, and you'll move their hand into extension, fingers still relaxed, and you'll place pressure at the third carpal above the base and tell them, hold, don't let me move you, as you push them into flexion. Good job. Extensor carpi radialis longus originates from the supracondylar ridge of the humerus. It inserts in the base of the second metacarpal, and its action as a result is wrist extension and radial deviation. It's also innervated by the radial nerve. Today we're testing extensor carpi radialis longus. You're going to have the hand flat like this and raise it into extension, fingers relaxed, and you're going to apply pressure at the second and third metacarpals, putting that into flexion. Hold and don't let me move you in my count. Go. For 5 seconds, and good job. Flexor carpi ulnaris originates from the medial epicondyle of the humerus. It inserts into the pisiform and base of the fifth metacarpal. Its action as a result is wrist flexion and ulnar deviation. It's innervated by the ulnar nerve. Today we'll be testing flexor carpi ulnaris. We're going to have the arm resting like this and have them move into supination. Arm a little forward there so it's hanging, and have them go into flexion. Thank you very much. Relax that. And you will apply pressure at the fifth metacarpal. On my count, hold, don't let me move you. Flexor carpi radialis originates from the medial epicondyle of the humerus and inserts into the base of the second and third metacarpals. The action is wrist flexion and radial deviation, and is innervated by the median nerve. And today will be manual muscle testing flexor carpi radialis. You will have the arm resting like this and turn it into supination. So you could have this arm resting here and have them go into flexion. Relax that. Go. And you will apply pressure at the second and third metacarpals, pushing that into extension on my count. Hold and don't let me move you.
Flexor digitorum superficialis originates on the common flexor tendon from the medial epicondyle of the humerus, coronoid process, and radius. It inserts on the side of the middle phalanx of the four fingers. Its action is flexion of the proximal interphalange and the metacarpal phalangeal joint of the fingers. Its nerve is median nerve.
And we're testing flexor digitorum superficialis. You're going to have them set up and turn their arm into neutral while supported. And you could test all of the fingers or one finger. You will isolate that joint and have their finger in flexion, and the middle and distal phalange are in flexion, and you will tell them to hold and apply pressure to the middle phalange. Hold, don't let me move you.
Flexor digitoris profundum. It originates on the upper 3/4 of the ulna. It inserts on the distal phalanx of the four fingers. Its action is finger flexion of all three joints, the DIP, the PIP, and the MCP. It's innervated by the median nerve and ulnar nerve.
And the muscle being tested is flexor digitorum profundus. It is only one joint away than flexor digitorum superficialis. You're going to have them rest their arm while supported in neutral. Isolate the joints all the way up to the distal phalange joint, and have them flex that and apply pressure, putting that into extension, and tell them to hold and not let me move you on my count. Go.
Palmaris longus originates on the medial epicondyle of the humerus. It inserts on the palmar aponeurosis. Its action is assistive in wrist flexion, and its nerve is the median nerve.
To test the palmaris longus, have your patient rest their hand here, flex their wrist, hold here, and apply pressure to the middle of the palm and say, hold, don't let me move you.
Extensor digitorum. It originates on the lateral epicondyle of the humerus. It inserts on the base of the distal phalanx of the second through fifth fingers. The action is extension of all three joints of the fingers, DIP, PIP, and MCP. The nerve is the radial nerve.
Test the extensor digitorum. Have your patient hand be flat and extend the fingers. Try and keep them a little bit like that. And apply pressure with about 2 fingers. You can go here, here, here. And hold. Don't let me move you.
Lumbricals. The origin is the tendon of the flexor digitorum profundus muscle. It inserts on the tendon of the extensor digitorum muscle. Action is finger flexion of the MCP joint while extending the PIP and DIP joint. The nerve is first and second lumbricals median nerve, and for the third and fourth lumbricals, the ulnar nerve.
To test the lumbricals, have your patient hand like this, up and supported, and pinch this paper, and don't let me take it away. Good.
Dorsal interossei originates on the adjacent metacarpals. It inserts on the base of the proximal phalanx. The action is finger abduction, MCP joint, and the nerve is ulnar nerve.
To test the dorsal interossei, have your patient's hand like this, grasp 4 fingers, and try to spread out your fingers. Go. Good.
Palmar interossei originates on the second, fourth, and fifth metacarpals. It inserts on the base of respective proximal phalanx. The action is finger adduction, MCP joint, and the nerve is ulnar nerve.
To test the palmar interossei, have your patient expand their fingers, put your fingers in there, and hold, and don't let me get away. Good.
Adductor pollicus originates on the capitate, base of the second and third metacarpals, and palmar surface of the third metacarpal. It inserts into the base of the proximal phalanx of thumb. Its action is thumb adduction, and its innervation is ulnar nerve.
We test the adductor pollicis, have the patient's wrist in neutral position, push into the webbing of their thumb and have them resist abduction. Hold, don't let me move you.
Abductor pollicis longus originates on the posterior radius, the interosseous membrane, and middle ulna. Inserts into the base of the first metacarpal. Its action is thumb abduction for the CMC joint and is innervated by the radial nerve. Abductor pollicis brevis originates on the scaphoid, the trapezium, and flexor retinaculum. It inserts onto the proximal phalanx of the thumb. Its action is thumb abduction and is innervated by the median nerve.
You test the abductor pollicis longus. You're gonna have the wrist in neutral and have them resist the adduction. So hold, let me move you. Okay, and to do the abductor pollicis brevis, you're gonna have them in the same position and push right here. Hold, don't let me move you. Extensor pollicis brevis originates on the posterior distal radius, inserts on the base of the proximal phalanx of the thumb. The action is extension of MCP and CMC joints of the thumb, and the nerve is radial nerve.
To test the extensor pollicis brevis, have your patient's hand lay sideways, thumb extended, and you're going to be resisting extension. So hold, don't let me move you. Good. Extensor pollicis longus. The origin is the middle posterior ulna and interosseous membrane. The insertion is base of distal phalanx of thumb. The action is extension of all three joints of the thumb, IP, MCP, CMC, and the nerve is radial nerve. Test the extensor pollicis longus. Have patient's hand in neutral, thumb relaxed, and then apply pressure to the top of the thumb. Hold, don't let me move you. Good.
Flexor pollicis brevis originates on the trapezium and flexor retinaculum, inserts into the proximal phalanx of the thumb. Its action is flexion of the MCP and CMC joints of thumb. Its innervation is the median nerve. And we have the pollicis longus. Its origin is on the radius anterior surface. Inserts into the distal phalanx of thumb. Action is thumb flexion of all three joints, IP, MCP, and CMC, and its innervation is the median nerve.
Test the flexor pollicis brevis. You're going to have the patient's wrist neutral, and you're going to have them resist the extension. Hold to let me move you. And for the longus, the same thing except up here. Hold, don't let me move you.
Opponens pollicis originates on the trapezium and flexor retinaculum, inserts on the first metacarpal. Its action is thumb opposition, CMC joint, and it's innervated by the median nerve. Opponens digiti minimi originates on the hamate and flexor retinaculum, inserts on the fifth metacarpal. Its action is fifth finger opposition, CMC joint. It is innervated by the ulnar nerve.
You can test the opponens pollicis and opponens digiti minimi together. To do that, you're going to have their wrist in a neutral position, their thumb and fifth finger touching, and don't let me pull your fingers apart.